surge in COVID cases and increased concerns about the Omicron variant are prompting shutdowns on college campuses and Broadway as the White House points to an acceleration in its booster program. Meg Terrell is here with the very latest. Meg.
Hey, Melissa. Well, we are seeing case numbers, hospitalizations, and deaths all rise. Cases up 40%, now averaging 120,000 per day in the United States. Deaths up also 40% over the last 2 weeks, now to more than 1,200 every day in the U.S. And community transmission across the country, now we're seeing 90% of counties considered high transmission or substantial transmission. Those are the red and the orange on this map there. That's where the CDC recommends everybody mask up indoors, regardless of their vaccination status. Now, most of the transmission we're seeing right now, according to the CDC, is still the Delta variant. The overall prevalence across the United States is about 3% of Omicron, but it varies regionally, and you can see really high prevalence in the New York, New Jersey area. About 13% of the sequences they're looking at in those states are Omicron, and you are seeing an effect on college campuses in particular. In just the last couple days, hearing from Cornell, NYU, and Princeton that they've all canceled events. They're moving finals online due to surges in cases, some of which they suspect are Omicron cases. Now, the way the public health world is responding to this, and health officials from the U.S. is emphasizing that booster vaccines appear to work really well. Dr. Fauci focusing his scientific presentation in the White House COVID briefing on all of the data we've seen so far, and he had this to say.
Our booster vaccine regimens work against Omicron. At this point, there is no need for a variant-specific booster.
And Mel, we did just see the first data for a Moderna booster actually presented by Dr. Fauci from the Vaccine Research Center at NIH, also showing a very similar trend that when you give that boost, you see the antibody levels really going back up against Omicron. Mel?
Meg, can you speak to the overall number of COVID cases? I saw a chart for the state of Connecticut this morning. I'm not sure if this could be extrapolated for the United States as a whole, but cases look to be at the same levels as last December. And if Omicron is still a very small percentage of cases, this implies that Delta is still raging and is still out there and is causing the case levels to tick higher.
Yeah, absolutely. And, there were some really concerning reports yesterday from a CDC briefing of public health officials where in one scenario, you have a high level of Delta cases. Then you get an Omicron surge on top of that. And we are also hearing that flu is now ticking higher as well. So you're looking at what one person called a triple whammy of these three respiratory diseases circulating at the same time, which really doesn't spell good news for the winter.